Welcome to Petcast, where we will be discussing interesting topics around dogs and cats from a pet parent point of view, as well as talking to highly skilled veterinarians. So we'll have, these veterinarians have some superb tips and hints and ideas about the health of your pets. So I'm Derek Cummins. I'm the CEO and co-founder of Pet Expert, and my co-host today is one of my colleagues, Michaela Pashkova. So who we've got in today? We're going to be speaking to Dr. Jan Čučka and also Dr. Zuzana Velecká. And what they're going to do, they're going to reveal a bit of life, what it's like to be in a busy clinic just on the outskirts of Prague, and also a little bit about the health of your dogs, particularly around orthopedic issues, which is really a topic that is discussed many, many times. So welcome, Jan and Zuzana.
Hi, nice to see you.
Hi.
So first of all, Jan, let's talk about yourself. Tell us about yourself, your career to date, and when you qualified as that young veterinarian and what you're doing today.
Hello. So I was starting at my uncle's clinic when I was 13 years old. So I was a helper at their clinic. After that, I started my studies at the Veterinary and Pharmaceutical University in Brno. I graduated 2005.
It's not so long ago.
It's a long, way. And after that, I came back to my uncle's clinic, and we were working together till 2009. And 2009, I just built a new veterinary clinic, Zvířecí, doktor, and we are still working there till nowadays. During that time, I made my postgraduate studies. So I've got 2 orthopedic certificates, one Improve International and one ESAFS. So I think I'm well qualified for orthopedics. So my most cases, what I'm looking for during my staying at my clinic is orthopedic and neurologic patients.
Perfect. So your clinic, I understand, is based in Kladno. Is that right?
Yeah, it is.
Okay. So to our listeners who don't probably understand, that word orthopedic, just simply explain what that means.
Orthopedic? Yeah. Everything around bones and joints.
Okay. And most dogs suffer from a bones and joint issue in their life?
So if you are limping, if you have some disasters around bones and joints, so accidents and other stuff, so all traumatic issues and some development issues around bone and joints, and also some neurological problems.
So you're a superb bone doctor. So Zuzana, over to you. So tell us a bit about your career so far and what you were doing working alongside Jan in Kladno.
Well, I graduated at 2012. Nowadays, I'm studying also ESAF's dentistry certificated program. At the clinic, I'm doing internal medicine, so you can visit me with some vomiting dogs or diarrhea dogs and whatever else. And I'm also helping Jan during orthopedics surgeries. Yeah, and I'm doing dentistry procedures at our clinic.
And I understand that you even travel abroad. You just literally got back from Dublin yesterday, I understand.
Yeah. I was on a course Dentistry 2, so we learned how to do some parodontology procedures. It was quite interesting.
Okay, so you're the tooth expert and Jan is the bone expert.
Well, I'm not expert.
You're working that way.
I'm working on
sure.
that way, yeah.
Okay, so great. Thanks for letting us know about that. So let's first of all get onto the topic of orthopedics and the bones and joints. In our business in Pet Expert, we see a lot of these cases, and it is not only about large dogs, but also little dogs as well. And those orthopedic problems tend to range from a cruciate rupture, like humans, to their knee out of place, a patella issue. I think dogs, traditionally, you see them limp, or they're limping. And the first thing you think when you see a dog limping, do they have something in their paw? But what is it that our listeners should be looking out for? When they see their dog limping, what should they do?
Go for orthopedic examination to the vet. So it's easy. But the most clients thought that their problem is some small trauma or some small accidents or muscle injury and something like that. But the most common orthopedic problem in the dog is cranial cruciate rupture. So it's the most common diagnosis, orthopedic diagnosis.
And how do you know when your dog has that issue?
You have to do some tests and exams. So the most important is clinical examination of the dog, some special orthopedic exams for knee, if we are speaking about cruciate, and then X-ray performing. X-ray is not designed for soft tissue. It's designed for bones, but there are some special signs of possibility of, for example, cruciate rupture. So if you know what you are looking for, you can see and you can find that. And that's it.
And how painful is it for a dog when they have a cruciate rupture?
Usually, if they are limping, it's painful. So
right.
that's
so
that's
some
easy.
dogs don't limp.
Usually, if those problems are chronic, they could be better in limping. So there's very decent limping or no limping. But usually there's some painful manipulation of the knee, and you could see some problems during walking or running of their dog.
And what's the risks to that dog if they don't get treatment pretty soon?
Usually, there is some healing process which coming for some repair of that problem, but usually those reparations processes are not perfect, so those joints become arthrotic usually. So and arthrosis is very painful, and treatment of arthrosis is very very complicated, and we are not able to definitely treat it. So we can improve arthrotic joints. There are some new preparates and drugs, but we are not able to definitely treat it.
So I've had the pleasure of actually seeing you live, being a surgeon, doing fixing a cruciate rupture. It's very technical. It's very similar to human medicine in terms of the equipment that you use, including steel plates or titanium plates and so on. And it's very a precise surgery. Tell the listeners, what's the most difficult part of doing that type of surgery on the dog, particularly when you're using plates to fix that.
You mentioned cruciate rupture.
Yeah.
Okay, so we are performing TPLO, so it's special osteotomy, so we have to cut the bone.
And TPLO stands for?
Pardon?
What does TPLO stand for our listeners?
Tibial plateau leveling osteotomy.
There you go. So everyone's an expert now. Okay, good.
Yeah.
So TPLO.
So it's kind of cutting bone at the proximal part of tibia. So it's upper tibia. And the most complicated part, I think, is to match what you prepared before. So you have to count everything and prepare before the surgery, and it should match during the surgery. So that's very important, and sometimes there could be some technical errors. And other complication or complicated part could be the performing of that surgery. So you have to cut the bone, rotate some part of the bone, fix the bone. So you have to apply screws and plates, and everything should be perfect. So all the mistakes or technical mistakes could do some other problems with walking, or those dogs
so
could limp.
It's a very precise surgery, in other words. Yes.
It is.
So I just bring Zuzana in here, because I've also been there, and you've also assisted Jan in these surgeries. What do you find most stressful about these surgeries, which can take sometimes a long period of time? 1 hour, 1.5, depending on the size of the dog or the complexity. What's the most stressful for you in that, or you're not stressed at all?
Well, the most stressful thing for me is that Jan don't see well, and he said he don't see well, and I'm not doing a suction properly. So yeah, that's the most stressful.
Okay.
Well, for me as an assistant, I don't see it so stressful as he as a main surgeon. I think. Yeah. But sometimes it's.
There's always the worry that you'll hit that blood vessel, which is never a good thing. Yeah, absolutely not. So let's talk about post-op, because the pet owners are always a bit worried about how their dog will recover. So after the operation, the pet the dog is still under anesthesia, and then they slowly wake up out of anesthesia. What should the pet owner expect, or that dog owner expect, after the operation?
So the first day, or
first day and continuing,
Okay,
let's say for the sort of recovery and rehabilitation period.
Okay, recovery period after TPLO surgery is usually 6 to 8 weeks, and the first week is the most complicated for pet owner, I think, because those dogs are still limping. It's not healed, so they have to be ready for some collar wearing, leash walking, some other restrictions of the movement of the patient. So it's very stressful for the pet owner to manage everything at the first week, I think, because when the time is going, everything is managed.
Sure,
it's more easier to go on.
And what shouldn't they do? What shouldn't they do as in the post?
Never ever. They couldn't lick the wound.
Okay.
So it's the most often complication.
Right.
There could be some terrible infection of the wound.
Sure.
And if there is infection of the soft tissue, there could be some infection under the plate, and it could be dramatic.
Yeah.
So it's the biggest issue for the owner. And other issue or bigger part of complication could be bad movement. So leash walking is other necessary restriction. Those dogs couldn't jump and do other bad things, so they should go just for slow walks with the owner, and everything should be set up.
Okay. So I'm going to ask both of you now, and bring Zuzana back into this conversation.
Well, maybe
do you want to add something?
Yeah, maybe for a lot of owners, leash walking doesn't mean what we mean.
Right.
So leash walking is not going outside on the flexi.
Flexi lead.
Flexi lead and running around the owner.
Sure.
So they should be walking really slowly next to the owner's leg.
Yeah. So you really explain that to the pet owners. Yeah. So it's not just taking them to the park on the flexi lead. And I see this as well with when licking the wound is a massive problem, because they have to wear the cone of shame, we call it, the lampshade, which are dreadful, but it's a necessity, and, I've seen, and I've experienced it personally where my dog was Houdini, managed to get out of this, I don't know how, still to this day, and then licks the wound, and then we're back to square one again, and that just causes complications. So I'm going to, again, ask both of you. I'm going to bring Suzanne. I'm going to talk more to Zuzana in a moment. But first of all, I've worked with veterinarians for a number of years, and their lives are very high pressure, lots of stress, long hours, lots of, sad times, but lots of good times as well. So what I'd like to do is to ask you two things, what's the saddest thing you've seen in your career so far, and what's the happiest thing where you actually feel like you contributed to as a veterinarian and the life of that dog? So, Zuzana, first of all, tell me.
So, maybe for the saddest thing that I've seen, well, when I was on the start of my career, I had my own dog was like a small puppy. And to the clinic came some dog which were just like him, with the view, and it was not the Vizsla, but he was like him. And he was kicked by a horse, I think, and he had broken mandibula.
Okay.
Yeah.
Which is
the jaw.
The jaw.
The jaw, yeah.
Broken jaw.
Yeah. So he was like in a really big pain, and he was suffering, and the owners didn't want to fix it.
Oh,
so they wanted to euthanize.
Euthanize the dog.
Yeah. So that was the saddest.
Yeah. So that's basically. We call that economic euthanasia, and obviously, with Pet Expert, we try to avoid that absolutely, because that eliminates that issue. Yeah. But I can imagine that's quite sad, because and it's difficult as a veterinarian to do that. So let's switch that into what's the happiest thing that you've seen, that where a happy story where perhaps you have contributed to it as a veterinarian, and now that dog, or it could be cat, it could be any animal, has now a great life.
Well, I guess it was like 1 or 2 years ago. The owners brought to us the dog after a wild pig attack.
Oh, yeah.
And he had open pneumothorax.
Okay.
Jan fixed him.
You fixed him.
Yeah, so I had some after surgery care about that dog, so it was nice.
So it's nice, and that dog is leading a happy life now.
Yeah,
I hope.
Nowadays he's happy.
Running after the pigs. Always, pig versus dog. Dog tends to lose most times. Yeah, the pig is especially the wild pigs. They're very strong. They have big tusks, and they can be quite tough. And I've seen many cases like that. So and over to you. Your saddest and your happiest time.
I've got similar problems, but
stories.
It's quite similar. For me, very sad are cases when we know how to fix it or how to help the animal, and we are not able to achieve it. So if there are some money problems or other problems around those cases. Sometimes pet owner thought that his animal is too old for some surgery procedure, and they don't want to fix it or don't want to achieve some surgery.
Sure.
So those cases are very sad because we know that we are not able to fix everything and save all the lives, but sometimes those cases are very sad because we don't get the chance to do something.
Sure.
So it's
difficult.
It's difficult to manage it at your own because we know that we are doctors and we want to treat everything, and we need some other part success or something like that. So those cases are very strange and sometimes very sad for us. And
on the happy side, there's got to be sometimes
wild pig.
You can't have the same story. Sure,
No,
there can't only just be one happy time.
Because that wild pig 2 years ago, it was thorax surgery. So he had a open thorax, and we managed some. I think we put some part of lungs away.
Okay.
So it was this case, and 2 weeks ago we had a other wild pig attack for tiny dogs. It was 5 kilos dog or something like that, and they came with 3 from 4 legs fractures. And it was not perfect, but one leg was loose with everything, so we have to amputate it.
Wow.
But we repair other 2.
Yeah.
And second day after surgery, this dog went home on 3 legs, so he was able to walk.
Which
second
a dog
day.
can, a dog can do. Yeah, because most people don't realize that a dog can walk
but
on 3
he
legs.
was walking quite good on 3 legs. So after
perfect.
that, he had terrible fractures. It was everything were open fractures.
Yeah.
So
very complex again.
There were a lot of implants and plates and screws.
Everything.
All the stuff. So we made for us good job, and I hope that owner appreciated. We were satisfied with that.
I'm sure they were really happy that dog survived and was able, even though he's full of metal, so no going through any X-ray machines at the airport. Yeah. Clearly that will show up. So let me ask both of you again. I go back to Zuzana. Tell me your advice to our listeners about what you think that pet owners should do to keep their dogs and cats and whatever pet they have healthy. What can you say to them that will prevent them from coming to you all the time? It's a funny question, but it's one that a lot of people always want to know.
Yeah, it's a funny question because of doing the course for my specialization.
Sure.
Yeah, so they should start clean the teeth. Yeah. Exactly, because when we see it, there is a lot of plaque in the mouths of the animals, and it's a lot of bacteria. And it doesn't complicate only thing with the mouth. It can also complicate a lot of skin problems, renal problems.
Sure.
When there is so big bacteremia, it can, it's a really big problem.
Yeah, this we encourage our clients always regularly go to the veterinarian for dental hygiene on the dog. People are a bit concerned about the older dogs because you have to have anesthesia, but what can you reassure them about that?
Well, the only thing which would you stop before a stomatologic procedure is the really big heart failure.
Right.
Even in other problems, you are able to manage inhalation anesthesia.
Yes, sure.
And to help the pet and make his life better.
Yeah.
Even if it should be like full mouth stomatologic extraction.
Right.
Yeah.
Sounds complex, but yes. So I means that taking everything away. I've seen lots of trauma around teeth as well from accidents, which is also a big issue. Jan, from you, what would you think that pet owners, pet parents, whatever you like to call them, what they should be doing to keep their pet healthy?
Groom them.
Apart from grooming them.
But for me, there's the other side. What's necessary to mention? It's not just health prevention, but there's a economic side of everything. And nowadays, it could be much bigger problem at all. All those people who want to pet their pets. They have to know that there is necessary to be ready for some costs.
Sure.
So just not feeding and other playing with the dog, but there is necessary to pay attention for some veterinary service.
Sure.
It's not something what I want to mention here as insurance and other stuff, but you know that what company.
Part of that we'll edit out, but it's okay.
Yeah.
So no, not to mention about insurance, but I think what's important definitely is around prevention. Prevention is everything. Every veterinary doctor that I say is that if you have prevention, then really it does avoid issues. The teeth is a good example, and other types of prevention like looking after the cat, the pet themselves. Things like regular vaccines and so on, and then they tend to live a longer and healthier life. One of the last things that I want to talk about is going to be a topic that I ask all veterinarians is, why do you want to be a veterinarian? So when you were younger, maybe a long time ago for you, Jan, but when you were younger, I'm much longer than me, right? So I'm longer, What made you say, you know what, I'm going to go to veterinary university and study for 6 years, 5-6 years, depending on what you're doing, and become a veterinarian? What was it, from your perspective? So Jan.
My perspective. When I was younger, then before my university studies, that I mentioned that I was a helper at my uncle's clinic. So it was some way how to spend my free time. So I was helping at his clinic all the weekends what I have free. So all the weekends and all the holidays. So it gave me some way of my future. So I was trying to find out if the medicine is the perfect way for me. So I thought that I would be a vet 100% sure.
Okay.
But you know that there are some changes in your life, and when I was 15, 16, I was thinking if the veterinary medicine is the right way, or if I would like to be a human doctor.
Okay.
Or if I spend my time or start studying some computer studies or something like that. It was around 90s or late 90s. So computers were something new and very interesting. So there was some decision to connect those two subjects, so computers and medicine. But after that, it was very easy. So I
definitely into medicine.
Yeah.
Okay. And Zuzana?
Well, for me it was nearly the same. Since I've been a small girl, I always said that I want to be a vet.
Okay.
So I had some small bag with some syringes and bandages, and I tried to treat my the fluffy toys,
teddy bear,
something like this, and then I tried it on our dogs at home and also horses. So there was some small period when I wanted to be a lawyer, but
Okay, so you got over that one quite quickly. Good. I mean, yeah, and you ended up as a veterinarian. Yeah. So look, that brings us to the end of this episode that we've got here today. I want to thank Jan and Zuzana for joining us. I think it was a very interesting and informative discussion about pet healthcare and also about your life as a vet, which I always find quite interesting, and not many people really know what it's like to be a vet. We hope that the advice that they've given you and experiences was beneficial to you. If you're ever in doubt, please consult your own veterinarian, where they'll be able to tell you, if there's issues with your dog. But, I always say, if in doubt, go to your vet. And as always, thanks for listening to Petcast. So if you enjoy the show, please rate and review us for your podcast provider. And be sure to come back next time for another interesting discussion with other veterinarians and people about pets and about veterinarian life. Until then, I'm Derek Cummins. I'm the CEO and co-founder of Pet Expert, along with Michaela Pashkova. And don't forget, keep your pets healthy. We will show you how.